Welcome to EPG Padashala. I am Dr. Gauri Shankar, physician from Department of General Medicine, Government Medical College and ESI Hospital, Coimbatore. Today's topic is anemia and its type. Anemia is the most common blood disorder affecting about 1/3 of global population. It is the manifestation of undernutrition and poor intake of food materials, which is rich in vitamins and minerals. Nutritional anemia is the most common anemia due to lack of iron, vitamin B12, folic acid, proteins and minerals. Anemia is ignored in most of the developing countries, even though it is one of the major public health problems. Anemia is common, it is harmful, but it is treatable. Today's topic, we are going to discuss about anemia and its types, causes of anemia, how to diagnose and how to combat anemia. What is anemia? Anemia is defined as decreased level of hemoglobin in the circulating red blood cells. Anemia lowers the ability of blood to carry oxygen. In ancient Greek, anaemia means lack of blood. Some of the facts of anemia. Anemia affects an estimated 25% of the world population. Iron deficiency is the most common cause of anemia, and it affects nearly 1 billion people in the world. Anemia is a killer disease in India. Anemia is a critical public health problem in our country. Every second, one woman is anemic in India. 1 in 5 maternal death is directly related to anemia. Anemia is one of the underdiagnosed condition and left untreated leads to serious complications. The physiology of red blood cells. The red blood cells are critical to our body's well-being, and it carries hemoglobin. Hemoglobin is nothing but a complex of protein that contains heme and globulin. The heme part contains iron molecule. The main function of the iron molecule in hemoglobin is to carry oxygen from the lungs to the rest of the body. In the picture, you can see the circulating RBCs inside the blood vessels. The red blood cells contains several hemoglobin molecules. So the heme portion carries oxygen from the lung. From the lung, it carries oxygen to the tissues and delivered to the tissues. Here in this picture, you can see the normal amount of RBCs, but in anemic patients, the red blood cells are low in number. Anemia is more common in women. Why it is more common? Because of heavy menstruation, pregnancy and lactation. In pregnancy and lactation, there is an increased demand. What are the high risk factors for anemia? The 3 high risk factors are demographic factors, dietary factors, social and physical factors. So in the demography, this is due to women's, common in women, teenagers, elderly patients. The dietary factors responsible are low iron, low vitamins like B12, folic acid, low vitamin C and fat diet. Fat diet is a bad diet planning for weight loss. This is responsible for anemia. And also the social and psychological factors are poverty, poor nutrition, and then patient with depression, they will have decreased intake that leads to anemia. Some GIT disease, patient with acid peptic disease, there is ulcer in the stomach, or hemorrhoids, that is piles, that is responsible for anemia. And also the alcohol abuse involves anemia. The causes of anemia are, the 3 main causes of anemia are blood loss, decreased red blood cell production and increased red blood cell breakdown. Let's see some of the causes of blood loss. I already told, heavy menstrual bleeding in women, trauma, that is road traffic accident, injury to the bones, that leads to major blood loss, gastrointestinal bleeding, that is bleeding in the stomach in case of ulcer, gastric ulcer patients, bleeding piles are responsible for blood loss. And also the worm called hookworm. Hookworm in the stomach or intestine is responsible for blood loss. Some of the causes of decreased production, iron deficiency, vitamin B12, folic acid deficiency is responsible for decreased production of RBCs. And also the genetic disease like thalassemia and the cancers of bone marrow are responsible for decreased production of RBCs. Some of the causes of increased breakdown, genetic disease like sickle cell anemia infections like malaria and certain autoimmune diseases are responsible for increased breakdown. So in this picture you can see the causes of anemia, that is excessive bleeding, menstrual bleeding, iron deficiency, vitamin B12 deficiency, cancer, chronic diseases, genetic diseases, or any abnormality in the spleen. Spleen is the storehouse of blood. Any abnormality in this that leads to anemia. Classification of anemia. It can be classified based on the size of red blood cells and the amount of hemoglobin in each cell. If the red blood cells are small, it is called as microcytic anemia. Micro means small. Microcytic anemia. The example for this microcytic anemia is iron deficiency anemia. If the red blood cells are large, it is called macrocytic anemia or megaloblastic anemia. The example for this is vitamin B12 deficiency, folic acid deficiency, hypothyroidism, alcoholism. If there is a blood cells normal in size, it is called as normocytic anemia. The example for normocytic anemia is patient with chronic disease of lung, chronic disease of liver, patient of cancer, infections like tuberculosis, HIV is responsible for normocytic anemia. According to WHO, that is World Health Organization, the cutoff values to say anemia. The normal hemoglobin in men is more than 13 gram per deciliter. If it is less than 13 gram, considered as anemic. In women, the hemoglobin value less than 12 is considered as anemic, and in pregnant women, hemoglobin less than 11 gram per deciliter is considered as anemic, and in infants 2 to 6 months less than 9.5 gram considered as anemic, and children 6 months to 24 months less than 10.5 gram is considered as anemic. Children with 2 years to 11 years less than 11.5 gram, and children from 12 years less than 12 gram is considered as anemic. Also the WHO grades anemia. It is graded as grade 1, 2 and 3. Grade 1 is mild anemic with the hemoglobin value is 10 gram per deciliter. The grade 2 is moderate anemic, hemoglobin value of 7 to 10 gram per deciliter. The grade 3 is severe anemia with the hemoglobin value below 7 gram per deciliter. Some of the clinical manifestations of anemia. The patients had feeling of weakness or tired, lightheadedness, they will have headache, poor concentration, shortness of breath on exertion, that is difficulty in breathing while walking or climbing stairs, that is called as shortness of breath on exertion. In very severe form of anemia, the body may compensate for lack of oxygen carrying capability of the blood by increasing cardiac output. So the patient may have symptoms of palpitation, that is abnormal heartbeat, angina, chest pain, that is intermittent claudication of legs, that is pain in the legs, and symptoms of heart failure. This will occur in case of anemia. On examination, we see the signs of pallor. Pallor in the conjunctiva, that is lower eyelid, pallor in the tongue, pale skin, pale in the nail buds. In severe anemia, there may be signs of hyperdynamic circulation. So there is an increased flow of blood in the heart that leads to fast heart rate, that is called as tachycardia. The pulse volume is increased, that is leads to bounding pulse. So abnormal sound called murmurs, that leads to cardiac enlargement and leads to cardiac failure. Chronic anemia in children leads to impaired neurological development, behavioral disturbances, and reduced academic performance. Anemia in pregnant mothers. 1 in 2 Indian pregnant women is anemic. So in this picture you can see the fetal growth from 8 to 40 weeks. So what happens in the anemic mother? The fetus growth is reduced, that is retarded, that is called as intrauterine growth retardation. The anemia is responsible for low birth weight babies, and that leads to failure to thrive. Anemia due to folic acid deficiency leads to neural tube defects in the newborn. If you look into the picture, you can see a normal weight baby compared with that of baby born with anemic mother. And in this picture you can see, because of folic acid deficiency, there is no brain formation occur, that is called as anencephaly, and also the abnormality in the spine in the lower back that leads to spina bifida, or abnormal brain tissue formation that is called as encephalocele. These are all the neural tube defects occurs in folic acid deficiency that leads to anemia. So always remember, anemic mothers make anemic babies. Some of the complications of anemia in mother. So pregnant woman with anemia leads to preterm delivery. The normal delivery period is on 10th month. So here the mother deliver in the 6th or 7th month. That is called as preterm delivery. Postpartum hemorrhage, that is bleeding from uterus after delivery, that leads to torrential bleed, and this leads to high risk of maternal mortality. How to diagnose anemia? We can do complete blood count. In the complete blood count, we can look for hemoglobin values and check for its cutoff corresponding to the age. And hematocrit, it is nothing but the concentration dependent, and look for RBC mass. Here in the picture you can see the test tube contains blood, the lower portion contains RBC and the upper portion has plasma. So in case of anemic patients, the RBC mass is reduced, hemoglobin is reduced, and hematocrit is reduced. And also the another investigation is peripheral smear. In the peripheral smear we can look for abnormal RBCs, and also in some disease there will be some specific characters in the RBCs. Come to the treatment part for anemia. The treatment for anemia depends on cause and severity. Vitamin supplements in the form of diet or drugs will replace a specific deficiency. Now, how to combat anemia? By dietary supplementation. Anemia treatment plans often includes dietary changes. The best diet plan includes iron, proteins, vitamins and minerals, which are essential for hemoglobin synthesis and RBC production. In this picture you can see the food rich in iron, that is meat, poultry, legumes, dry fruits like dates, broccoli, egg yolk. These are all iron rich diet. And also the vitamin C diet, it helps in absorption of iron. So consuming food rich in iron decreases iron deficiency anemia. Consuming food rich in vitamin B12 and folic acid decreases macrocytic or megaloblastic anemia, and also vitamin C helps in absorption of these products, that is iron. And one thing you have to note, consuming caffeine products, that is coffee and tea, after food, it interferes the absorption of iron. So never to consume caffeine products after food. We can treat in the form of tablets. The iron tablets are available. That is a mild to moderate iron deficiency anemia, usually treated by oral iron tablets with ferrous sulfate, ferrous fumarate or ferrous gluconate. Some of the side effects of iron tablets, usually the patient will have stomach upsets or darkening of the feces. Stomach upset we can alleviate by taking the iron with food, and also the vitamin C helps in to absorb iron. So taking iron tablets with orange juice is of benefit. Iron deficiency anemia by giving injections through intramuscularly or directly into the blood, that is intravenously. When oral iron has either proven ineffective or patient with some side effects like stomach upset, in such situation parenteral iron is suggested. Our body can absorb up to 6 mg iron daily from the gastrointestinal tract. Many of the patients have deficit of over 1000 mg of iron, which would require several months to replace. In such cases, we advise injectable form of iron. Anemia due to folic acid deficiency can be treated by folic acid tablets. Anemia due to vitamin B12 deficiency can be treated by vitamin B12 injections. Regarding blood transfusion is recommended in patients with severe anemia, that is a hemoglobin value below 6 to 8 gram per deciliter, patient with symptoms of heart failure, that is breathing difficulty, palpitation, chest pain. In such situation, the hemoglobin value 6 to 8, we advise blood transfusion. And also the active bleeding from injury site, that is road traffic accident. In such cases there will be a active bleeding. So in such situation we cannot give iron tablets, we can treat by blood transfusion. And also the erythropoiesis-stimulating agent. If you look into the normal kidney, it secretes a local hormone called erythropoietin. It is called as EPO, erythropoietin. This erythropoietin acts on the bone marrow, that stimulates the production of RBCs. So that's to maintain oxygenation level. But in case of damaged kidney, that is chronic kidney disease or renal failure, which occurs due to uncontrolled diabetes, uncontrolled or untreated hypertension, in such situation the kidney will fail. That is called as renal failure. In such conditions, erythropoietin production level will be low. That leads to decreased production of RBCs. That leads to anemia. In such cases, anemia can be corrected by erythropoietin injection. Another very important one is deworming. Deworming, I told the hookworm infestation is one of the commonest cause of blood loss. So deworming regularly is responsible to combat anemia. Conclusion: anemia is a killer disease affecting 1/3 of global population. Anemia increases cost of medical care and lowers a person's productivity through a decreased ability to work. Anemia should be taken seriously. It is more than tiredness, it affects entire body. It leads to serious implications in growing children, pregnant women, lactating mother, and even it leads to cardiac failure. According to World Health Organization, India is one of the countries in the world with high prevalence of anemia. In India, our aim is 12 gram by 12 years of age. Let's pledge to make anemia-free children, anemia-free family, anemia-free school, anemia-free India. Stop anemia. Thank you.